In fact, calcium and vitamin D are not considered as a treatment plan.
Okay.
They are absolutely mandatory, but treatment plan is having certain category of medications.
Okay.
Now, bone density test is a very easy test.
Okay.
There are various types of tests available here. The most commonest one which is available in the community is doing a bone density test, which is ultrasound based. It's a small device that the health worker will get to probably your hospital, clinic, or the community society. A person puts his foot inside the machine, and the machine gives certain amount of number.
Right.
And something less or more than that number will define whether you are normal or you are osteoporotic. There are two stages in between the normal and the osteoporosis. So typically a person, when the bone loss starts, from a certain level to a certain level, it is known as osteopenia, which is the low bone mass. And after it has hit the threshold level, which is probably a T-score of -2.5, it is called as osteoporosis. I love mobility.
Oh, you love mobilities? Okay. Hello, and welcome to the episode of The Health Talk with me, your host, Dr. Sagorika. Today, we will be diving into a topic that affects millions worldwide, but still, it often doesn't get the attention it deserves. I'm talking about osteoporosis and bone health. And no, it is not just your grandmother's disease. Joining us today is my friend, Dr. Deepak Jagiasi, who's a clinical densitometrist with more than 3 decades of clinical experience and a passion for bone health.
Dr. Deepak Jagiasi is an alumni of Grant Medical College and JJ Group of Hospitals, Mumbai, with more than 30 years of experience in clinical practice. He has certification from the International Society for Clinical Densitometry, United States of America, and is associated as Consultant Clinical Densitometrist with Susceptible Hospital, Mumbai. He is part of the Fracture Liaisoning Service team who identify patients with osteoporosis and provide appropriate treatments. He is also a DEXA 3D QCT and BMD scan validator and trainer. Dr. Deepak has founded Bone Enterprises, a company that spearheads bone mineral research and undertakes clinical trials.
Welcome, Deepak, to the Health Talk.
Thank you, Dr. Sagorika. It's always a pleasure to be on your show.
Yeah. So, Deepak, as I said, you have a passion for bone health, and there are lots of patients who come to me and they come with a lot of bone pains, and then they say that they go to orthopedic, and the orthopedic has diagnosed them as osteoporotic. So, what exactly is osteoporosis? Can you just explain it to us in simpler terms?
Sure. So, osteoporosis is derived from 2 Latin words.
Okay.
One is osteo, which means bone, and the second one is porosis, which means there is some porosity. So, put together, it is porosity of the bone, which is known as osteoporosis.
Right. But bones are supposed to be very strong, right? So how does it become porous? I mean, whenever we see bone, they are like solid structures. So how does it become porous?
So it's a natural phenomenon of the body.
Okay.
There is a regular wear and tear of the bone.
Okay.
There is the old bone is just absorbed,
Okay.
and then a new bone is layered. So there is a process which is a continuous process.
Okay.
Which starts from your birth, and it is lifelong.
Okay. So what happens? Like initially, the bone the bone is made more, and then later it gets destroyed more, or there's a loss more. Anything related to age?
Oh yes. Now, interestingly, once a child is born,
Right.
it almost gets the 80% of the bone from the mother.
Okay.
And it's a continuous cycle.
Mm-hmm.
Till the age of 20, a person keeps on getting more and more bone.
Mm-hmm.
And typically in women,
So that's how the height increases?
yes,
Okay. More and more bone gets
more and
laid.
more and more bone is getting formed every
Right.
day. And between the 20 and 29 years of age, this is the peak age during which you attain maximum bone mass.
Okay.
So this is how up to years of 29 years of age, a person would always be in the positive phase of bone forming. But as this process slows down, there is a reverse process which takes up.
Mhm.
And this is known as the resorption of the bone.
Okay.
And this is how, if the resorption is more, then you get porosities in the bone, and this is how you recognize that you are becoming osteoporotic.
I see. So directly somebody becomes osteoporotic, as like, is there a something before that also? Like, I've heard the word osteopenia also.
That's correct. That's correct. So osteopenia, or we call it as a low bone mass.
Mm-hmm.
So there are two stages in between the normal and the osteoporosis. So typically a person, when the bone loss starts, from a certain level to a certain level, it is known as osteopenia,
Okay.
which is the low bone mass.
Mm.
And after it has hit the threshold level, which is probably a T-score of minus 2.5,
Mm-hmm.
it is called as osteoporosis.
Okay. So it is something like, how we talk in diabetes, pre-diabetes and diabetic.
Oh yes.
Something similar to that, So,
In fact, I would like to point out one more thing here, which
Right.
people forget. We have another stage also now, which is defined,
Mhm.
which is known as severe osteoporosis.
Okay.
So severe osteoporosis is something where the T-scores are less than minus 2 or minus 3.5, or a person has had a fracture.
Okay.
Yes. So you have normal bone, then you have osteopenic range, then you have osteoporosis, and the final stage we have the severe osteoporosis.
So even with a minus 2.5 score and somebody who's had a fracture, you will say it's already severe osteoporosis?
Oh yes, you correctly said it.
Okay, fine. But why are we even talking about it? Is it really that common? Who gets affected with it? Men, women, children, who is it?
I think, as you rightly said
Huh.
in the beginning of the talk, in the introduction, that it is not the grandmother's disease.
Hmm.
So there is a huge myth
Hmm.
that it was a grandmother's disease.
Right.
But it is not so.
Okay.
Osteoporosis can begin any time. So since we already talked of the mother passing on
Right.
gift of bone health to the baby,
Right.
which is almost 80% job done by the mother.
Right.
And then there are various stages of growth. So what is happening here is we are passing through different stages here, and whichever stage there is a lacking or which is missing out in the appropriate terms, osteoporosis is going to begin from here.
Okay.
Yes, so it is not necessary that you have to turn into a grandmother to become osteoporotic,
Right.
but you will see children.
Mm-hmm.
Now, children, when they are building up bone, if they do not be on a proper diet, or let us say a child refuses to drink milk or eat a balanced diet, he is going to become osteopenic first,
Right.
then he will become osteoporotic.
So
This
it
is
can
one.
affect children also.
Oh yes.
Okay.
Now, after a child, gets into the adolescent age, his hormonal balances keep changing.
Right.
And if there is some kind of hormonal imbalance, or unfortunately, if he gets some diseases which are hormone dependent, he will turn osteoporotic. Now, when we say some kind of imbalances, these imbalances could occur because of certain medications, certain diseases.
Okay.
So, if somebody is on certain medication,
Mm-hmm.
they will become osteoporotic.
Mm-hmm.
Now, let us come to the final stage. You are more than 29, you are men or women, irrespective of your gender or your age. Your process of resorption is higher than the process of anabolic process
formation
here,
of
formation of bone. you can become osteoporotic. It's a simple math.
Mm-hmm.
You need to maintain a balance of lower resorption and a higher, bone formation stage
Right.
to avoid getting osteoporotic.
Right. So, is it possible that we can reverse bone loss, this kind of a thing? I mean, is there any methods naturally that we can help reverse this bone loss?
Oh yes, it's very much easy, and almost most of osteoporosis is completely reversible.
Mm-hmm.
Just the way we talked of what things could go wrong,
Mm-hmm.
you need to address those issues there,
Right.
and everything will get corrected. So if a child, if he is not on a balanced diet or if he is not having adequate amount of milk, you give him that
Mm-hmm.
and you will be able to reverse the osteoporosis.
Right.
If you have a female patient or a male patient who are getting deprived of some hormonal or they have a hormonal imbalance,
Mm-hmm.
you correct that stage and you will be able to reverse their osteoporosis.
Okay.
So I divide them into factors which can be corrected or factors which cannot be corrected.
Right.
They are dependent on a few things.
Right.
But yes, it is mostly reversible.
Okay. But then that's a great news to hear, that it can be reversed. But then how do we understand at all that, a person is becoming osteopenic or osteoporotic? Are there any warning signs and symptoms for that? I mean, how do you understand? How will a general person understand?
Exactly.
What is the suspicion?
Oh yes. Actually, you have pointed out directly to why is this not known? What are the telltale signs? In fact, that is the reason why this is called as a silent disease.
Okay, so then please give us some pointers that we can see, people will know that, how to think of it, or at least have that suspicion. That,
Yes.
okay, if I'm having this, I should get checked out or something like that.
Correct. So, there are certain signs and symptoms, which you can pick up. Even if it is a silent disease, there are certain complaints that a person says.
Mm-hmm.
The first thing I hear is, I get difficulty in standing up while I'm sitting down. So while I'm sitting in the chair,
Okay.
if you tell me to get up, it is a little bit difficulty than when I was 20 years old.
Right.
20-year-old would just spring
Jump
back
up,
and,
right,
and jump
right.
up. But osteoporotic person who has been having significant bone loss will not be able to stand up with that ease. That is one thing. Certain aches and pains, they're the different things. More or less, it is silent till that stage. It is a silent disease, we do agree.
Right.
There are certain pointers, which the disease gives you, certain aches and pains you
Mhm.
will start having.
Mm-hmm.
But yes, a confirmatory test obviously is doing a bone density test.
Right.
So I say what ECG is to heart,
Uh-huh.
BMD is to bones.
Right. But what happens if somebody comes with a fracture? Is that also a sign of osteoporosis?
90% of the times, yes.
Okay.
Because people, when they get fracture,
Mm.
unless until it is not a high volatility accident where they had a fracture.
Hmm. With simple falls, if they get a
simple
fracture.
falls, yes. Typically, simple falls when they get, I would say, a low intensity fall, or somebody practicing some football and he had a fall, or a race during a parent-teachers meeting where somebody fell down and he broke his bone. I would say this is a signal to tell us that this is osteoporosis.
Any easy fractures, we need to be careful.
Oh yes.
Right. So, these are the signs and symptoms which we can look for. So, are there any risk factors which we need to be careful about, that okay, we should avoid certain things or we should do certain things so that we don't become osteoporotic?
Oh yes. I would divide them into two categories.
Okay.
So I call them as a modifiable factor and a non-modifiable factor. So modifiable factors, something like smoking or alcohol. These are all modifiable
What about
factors. Oh yes, diet also is a modifiable factor. There's a huge list. I can forward you a list, of modifiable factors here.
Mm-hmm.
And then we have a non-modifiable list,
Mm-hmm.
Typically somebody having certain diseases,
Okay.
as easy like somebody having some seizure disorders,
Okay.
or somebody having bronchial asthma,
Mm-hmm.
somebody having some cancers,
Mm-hmm.
or somebody having thyroid issues.
Mm-hmm.
They are completely modifiable factors here.
Mhm.
You treat them and you will be able to treat osteoporosis.
Right. Right. Okay. So, how do we increase our bone density? Is there a way where we can, simply like, instead of taking any medicines or something by natural, normal methods, are there methods of improving our bone density?
Oh yes, there is an easy calculator.
Uh-huh.
You know how to know that whether you are at risk of osteoporosis.
Okay.
I will forward the link to you once.
Absolutely.
Once we have this.
So definitely attach that link there in the information.
So this is certain questions, and when you keep on answering those, you get to know that you are at risk of certain things here.
Right.
So the easiest risk factor, or one of the first questions is, did your parent have a fracture?
Right.
So it starts from there, So this is something which cannot be modified.
Right. That's
You know,
genetics.
Yes.
Right.
Right? Then there is a second question, do you smoke?
Okay.
So do you drink alcohol?
Right.
Do you have some secondary diseases?
Okay.
Like bronchial asthma, certain things. Then there is a list of something like secondary diseases whether you have. And the final question is that did you have a bone density test? And
What about physical activity?
physical activity,
Does
Yes.
it help? In our bone density? Does it improve our bone density?
oh yes, it is an unsaid rule that
Mhm.
you need to be active to ensure that you maintain your bone density.
How much of physical activity is actually needed per day to maintain our bone mass?
I don't have an exact number for you here, how many hours of activity you need, but I do recommend people to have a walk for at least 40 minutes every day.
Right.
That is the minimum activity that they should be aiming at.
Right.
If you can build in some strengthening exercises, muscle strengthening exercises, resistance exercises, it gets better and better.
Okay. So these kind of exercises, they do help in building our bone mass
Oh yes.
and
Oh, yes.
also reversing osteoporosis.
Definitely.
Great. So, it's actually certain very simple things like, have your diet properly, take your milks or whatever is giving you the calciums, and, exercise well, avoid smoking, avoid very simple things which you can actually do.
True.
And avoid osteoporosis. I'm sure, you should try these options what Dr. Deepak is telling. So, you were talking about, diagnosing osteoporosis with a simple test. Like, what is that test? Can you just give us a little more detail about that?
So bone mineral density test,
Mm-hmm.
popularly known as the BMD test. Now BMD test could be in various forms.
Okay.
The simplest one which everybody might have seen
Mhm.
is that there is a small machine where you put your foot and you get certain number. So BMD test is something like what an ECG is to a heart.
Right.
Correct? Now, if there was something wrong with the heart, you
Mhm.
need to do a ECG.
Right.
If you are expecting something wrong with your bones,
Mhm.
you need to do a bone density test.
Okay.
Now, bone density test is a very, very easy test.
Okay.
There are various types of tests available here.
Mm-hmm.
The most commonest one which is available in the community is, doing a bone density test which is ultrasound based.
Mm-hmm.
It's a small device that the health worker will get to probably your hospital, clinic, or the community society. A person puts his foot inside the machine, and the machine gives certain amount of number,
Right.
and something less or more than that number will define whether you are normal or you are osteoporotic.
So it's not a painful test at all.
Absolutely no.
Okay.
None of the bone density tests, are invasive tests. They are
Okay.
non-invasive tests,
Right.
so there is no pain here. The second test, which is more popular, is known as a DEXA, The correct terminology would be a DXA. It is a dual energy X-ray absorptiometry.
So it's basically an X-ray test.
Yes.
Okay.
So there is a small couch on which a patient lies down. Below the patient is an X-ray source, and it has a C-arm, and on the other end there is a detector. So there is an X-ray which goes through your body.
Right.
The body tissue absorbs certain energy, and the balance energy which comes on the detector is taken up by the machine.
Right.
And it calculates how much energy is retained by the patient. And we are able to calculate what is the...
So what retains that energy in the bone, the calcium?
Absolutely.
Right.
So, as you can understand, a patient when he is lying down, so the X-ray source is going through a lot of layers of skin, then the subcutaneous tissue, the muscle, the fat, the peritoneal fat, and the exact same on the other side.
Right.
And what we are more interested here is how much of energy is being retained by the bone. It is by that you are computing a bone mineral density test.
So the more the calcium in the bone, the more the stronger the bone, more it is getting retained.
Yes.
And the less it is, then the more bone is weaker.
Absolutely correct. Absolutely correct.
No, that's a very simple way of finding it out. Any other tests?
Yes. On a research setting, there is some other test called as quantitative computed tomography. So this is a QCT test, which is a benchmark test used in a lot of research settings here. And this is incorporated in the CT scanners or the PET CTs. So with one equipment, you will be able to get two test results here.
Right.
For the convenience of patients, when patients are going for their regular screening test for, let us say, cancers.
Right. And cancers make you prone towards osteoporosis.
Yes. So while they are undergoing a PET investigation, during that same sitting itself, you can do this test.
That's good. That's really
So
good. So
these are the three most popular tests available here.
But I'm sure the QCT will be, as you said, it's more in the research, or it will be an expensive test. But bone density is pretty decently priced and easily available, and that is enough to actually diagnose.
Yes.
So that we can do it very simply.
Yes.
Right.
Yes. Yeah.
Right. So now that we have diagnosed, how do we treat them? How do we treat?
Okay. So osteoporosis per se, like people understand that this is only calcium and vitamin D.
Right. People think that as long as I keep taking calcium D and vitamin D, calcium and vitamin D, then I'll never get osteoporosis.
That's correct.
So that is not right?
That is absolutely correct. It is inadequate just to
not
take calcium.
Not enough. Right. It is necessary, but not enough.
In fact, calcium and vitamin D are not considered as a treatment plan.
Okay.
They are absolutely mandatory, but treatment plan is having certain category of medications.
Okay.
So, as a person who advises people what medications they should be taking,
right,
irrespective of the calcium and vitamin D, which are the building blocks of making calcium in the body,
right,
we have two categories of treatment plans. One is where you are aiming directly to increase the bone density of the person.
Okay.
This is the anabolic category.
Right.
Then we have another category where you are avoiding loss of bone,
right,
or which is more popularly known as an anti-resorptive medication.
Right.
So one is for adding the bone, one is to stop the loss of bone.
Stop the loss.
So these are the basic plans to treat the patients for osteoporosis management. Of course, calcium and vitamin D need to be added every day. You need to advise the patient to do regular exercises every day.
Right. How much of calcium is normally needed for a person to just maintain normal good calcium levels in our body? And what about vitamin D?
Yeah. So depending on the age factor and the gender, I would say a person has got different requirements as per the age.
Right.
So typically a child may need a little more calcium.
Obviously.
Then adult may need an average amount of calcium, and definitely the old may require a little more calcium. But somewhere in between, I aim to ask or maintain patients on 1200 milligrams of elemental calcium per day.
Mhm.
So these can be advised to patients through normal diet.
Right.
In case the person is not able to get that amount through a normal diet,
Mhm.
then we recommend them to take a supplement.
Right.
Unlike what people actually think that I should pop in a pill every day,
Right. Doesn't really help.
it does not help invariably.
Right.
The basic reason being, when you ingest calcium,
Mm-hmm.
there are a lot of factors which are going to affect it being available biologically.
Okay.
It goes through various stages, from the digestive system, it should go into the actual bones here. There are
Right. From the
different-
digestive to the blood to the bone.
Yes.
So, there are lots of layers before it actually
Exactly.
reaches the bone.
Exactly. So this absorption is going to be, difficult, and a person may have some pre-existing diseases.
Mm-hmm.
I can give you a common example.
Mm-hmm.
People on regular, medications to treat their acidity,
Mm-hmm.
the calcium is not absorbed.
So there's no point giving a calcium to that
Yes.
person if the person is
Exactly.
already on antacid.
Yes.
And nowadays, so people pop, just pop those antacids like chocolates, like literally.
Yeah.
So,
Giving a person calcium through a normal diet is the most adequate or the most correct method of treating.
right. So I think they should follow a nutritionist advice to get the right amount of
Exactly.
calcium
Exactly.
every day. And obviously, sun exposure for the vitamin D.
Of course, there is nothing to beat like a good walk, at a particular time of day where you will be able to get a regular dose
Any
of
particular
sunshine.
time would you advise?
Based on the latitude and longitude where we are placed, like typically India,
Mm-hmm.
I would say anywhere between 9:30 to 10:30 in the morning and
Right.
evenings 4:30 to 5:30 in the evening. These are the particular timings where it has been suggested that
You
you
will get the
have
best amount
chance
of vitamin
vitamin
D.
D exposure.
Right.
Yes.
Good. So then these are some simple tips which people can very easily follow.
Hmm.
Are there any natural remedies for this? Like, as you were saying, maybe the diet would be a natural remedy for osteoporosis and exercises, right?
Yes.
Or other than that, anything?
So diet is one thing which is very important for a person.
Mm-hmm.
If people are not getting through diet, supplements are available. But there is certain exercise, which is completely unavoidable. Like if a person does not do exercise,
Mm-hmm.
I can't give him certain pill that is going to compensate for the exercise.
Right.
He has to put in that hard work.
Hmm.
They have to put in that resistance training exercises. They have to go for a walk. They have to ensure that they have that activity every day.
For everything, there is no pill, right?
There cannot be.
There cannot be a pill for everything. You have to earn that bone density yourself. Right. So you have been practicing for so many years, Deepak. So I'm sure you have seen so many patients. Would you like to share some success stories, so that it can motivate people to do what you're advising them to do?
So, for me, every day is a success story actually.
Absolutely, I'm sure. But something very specific, which will help our people to understand the importance. Can it actually give miracles?
Oh yes.
Right.
Oh yes. I have seen these miracles happening almost every day.
Okay.
It begins with a person realizing that he needs to take help.
Right.
That is the first and foremost thing.
Right.
So I see people, coming with their loved ones, who are their caregivers, and typically a daughter bringing the mother or the father, saying that my dad has been complaining of these pains, and I think he needs to be investigated for, his poor bone health.
Right.
This gives me an immense satisfaction to know that you have a loved one who is willing to take care of you.
Right. Somebody is actually there.
Yes. There is a second group which is there. I see a lot of unrelated old people bringing their friends to the clinic and saying, ki, please check him that he may be osteoporotic, and he has been having difficulty, when we are in the park, he is walking so slow, and he has slowed down.
Absolutely.
So,
humanity is still alive.
yes.
Absolutely.
They still have no clue what is happening, but they know that this is osteoporosis.
Something is going wrong.
This is osteoporosis.
Right.
Now, the minute you see someone is going to take care of you,
Mm-hmm.
it is almost a success story for me,
Mm-hmm.
because I know whatever advice, it is not one person, there are 2% involved now who are going to actually follow whatever I tell them. Today morning itself, I had this lady who has been following up with me for past 6 months now.
Mm-hmm.
In fact, this was her second follow-up today.
Mm-hmm.
And the daughter told me that mom is a lot better.
Okay.
This was her opening statement before she actually sat down.
Oh, wow.
I said, great, so what do we do now? So she said, we have brought tests for you to analyze. So I checked, I said, yes, that's absolutely true. She is definitely better, and you already said that she's feeling better. I said, but please tell me, why do you feel that she's better? So she told me that my mother has stopped complaining of aches and pains.
Right.
So she said either she's completely annoyed at me asking her every time whether you still have pains, but she said now I can make out genuinely she walks a little faster. So she is
So you
able
can
to catch
actually
up.
see the
Yes.
change. You can
She
actually.
has been able to see that she has been. It's pretty visible. She is on a daily medication of an injectable now, and it is definitely helping her.
Great.
So this is a success story.
Oh, definitely, absolutely. When you see, I think that is the best reward which we doctors can get. When we see a patient getting better.
Yes.
Oh, that's really makes your day.
Yeah.
Absolutely. So, Deepak, tell us something about any newer advances or something which we are, which we should know about osteoporosis. Something is coming up.
Treatment-wise, I would say there are 3 drugs on the horizon.
Okay.
We should be seeing these 3 drugs available in the Indian market maybe 2025 itself.
Yes, and they're going to make the treatment easier.
Much easier. Yes. And because currently we have 2 categories of drugs. Either they are making the bone or they are stopping the loss.
Right.
So this drug is going to do both the jobs at the same time.
Oh wow.
Yeah.
2 in 1.
Yes. So the newer drugs are towards achieving maximum within the lesser dose here.
Mm-hmm.
That is one thing.
Anything about diagnosis?
Yes, we are seeing some papers coming about a new test which is going to be a biomarker test,
Mm-hmm.
which is known as a CCN3. Now this is some maternal hormone which we are trying to test. It is still not available in the regular labs, but we should be getting this in another 2 years.
So what means it is going to diagnose it at a much earlier stage?
Yes.
Oh, that is good.
As I already mentioned that 90% or close to 80% of the bone mass you get from your mother.
Right.
This is a biomarker test which is going to tell you how much was the peak bone mass you could have attained in your life.
Okay.
Yes. So this is going to give some newer insight into the whole profile of the osteoporosis test.
Well, looks like we have covered a lot of ground today, and I hope our listeners feel more empowered about taking charge of their bone health. But all work and no play makes Jack a dull boy, and we don't want that for Deepak, right? So here are some rapid fire questions for you, and you do have to answer them rapidly.
Oh yes, I am not osteoporotic.
Right. Okay, Deepak, so let's start with texting or talking. What do you prefer?
I prefer to talk.
You prefer to talk. Texting is so boring. Absolutely. What's your favorite day of the week?
Interesting.
Right.
If I was allowed to have 3 units a week, I think the best day is the Friday, Saturday, and Sunday.
So 1 unit per day. Right. What's your favorite holiday destination?
On my list, I think going to Kashmir is the best destination.
Have you been there? Not yet.
No, not yet.
So that's in your bucket list.
Right.
Are you a morning person or a night owl?
I'm a complete night owl.
And what exactly are you doing in the nights?
Running on the beach.
Oh, you're blessed to have a house next to the beach. Okay, so what do you think is your super strength?
My ability to connect with people, talking to them,
Mm-hmm.
trying to explain them what osteoporosis is, how they can avoid osteoporosis, being funny with them.
Great. I mean, humor I think is one of the best things, to
Yes.
connect with people.
Yeah.
Right. So do you like Bollywood music?
Oh yeah, I absolutely love them.
Oh, love them. Okay, so any particular favorite you have?
Kishore Kumar, I love Kishore Kumar music.
Any of the songs of them, they're lovely. Absolutely. Do you enjoy getting wet in the rains?
Oh yes.
Not Bombay rains, I'm sure.
I love Bombay.
Oh, you love Bombay rains? Okay. Fine. Great. Right. Are you active on social media?
I try to learn all social media. I'm not great with that, but yes, I'm literally there on all the platforms.
Great. So if anybody wants to search for Deepak, they can check out the platforms.
Oh yes.
And we will give all the details in the information, don't worry. So any particular favorite season you have in the year?
I love the winter season.
So this is winter now going on, so.
I'm loving it.
Right. Okay, but a little serious question, okay? Who do you think has got it easier in life, men or women?
You mean to say easier getting osteoporosis?
I have just asked the question, you have to answer.
I
You can't
think
ask questions over questions.
I think women get osteoporosis much easier.
Is it? No, but let's not talk about osteoporosis.
Okay.
Let's talk about life. I mean, we have spoken a lot about osteoporosis already.
Yeah. It's upon an individual. I have seen a lot of women having more fun than me, and I always envy them.
Because it's always like, oh, women have it much harder in life and men have it a lot easier.
Oh no!
Oh, no.
I know a lot of women who get it easier.
Are you jealous of them?
Oh yes, I am.
Right. Okay. So, any particular, take-home message you want to give our viewers?
The best message is try to be happy, stand tall, take care of your loved ones, and take them to a doctor in case you think they are unable to stand tall and they need help.
And get a bone density test done.
That will be advised once you reach the doctor.
But you're supposed, aren't you going to tell them that, this is the time to get your bone density test done?
That's not me telling you, it's Sagorika telling you, please get a bone density test done.
Please get a bone density test done. Right. And there you have it, my dear friends. Remember, your bones support you every day. And now it's time for you to support and return the favor. So as Dr. Deepak said, it's time for you to have your bone density test. And thank you for joining us today. If you found this episode helpful, please share it with someone who might benefit from this information. For more such health insights and expert interviews, subscribe to my podcast, The Health Talk, on YouTube. And you can follow us, Dr. Deepak Jagiasi and me, Dr. Sagorika Malik, on our Instagram and Facebook accounts. All the details are mentioned in the episode information. Until next time, stay strong, stay tall, inside and out. Thanks, Deepak, for joining me today.
Thank you, Dr. Sagorika. It was a real pleasure to be interacting with you.
Thank you.
Thank you for tuning into today's episode. If you enjoyed the conversation and found it helpful, be sure to subscribe to The Health Talk with Dr. Sagorika Malik for more such insightful discussions. You can follow us on Instagram, and remember, you can also catch this episode and more on Spotify or your favorite podcast app. The links are provided in the description. We would love to hear from you, as your feedback will help us to bring you the topics that matter most to you and your family. So until next time, stay informed and stay healthy, one episode at a time. And don't forget to like, subscribe and share this episode. Your health journey starts here.